Hello guys, Dr. Rahul this side. So now we will be discussing regarding RBC inclusion bodies, right? RBC inclusion bodies and their shapes. So this is our topic today, and this is very important. So we will discuss about abnormal morphologies of RBCs, then the image and the conditions where we can find these abnormal morphologies. Sometimes you can get the names of the morphologies, or sometimes you can get the images, right? Or sometimes you can get the conditions and they will ask about the abnormalities found, right? So we will have a look at it, right? So we will get back to the chart later. First we will discuss some the some of the important inclusion bodies and their shapes and the conditions, right? So the topic is RBC. One second. This is our topic, RBC inclusion bodies, right? So I will make okay okay, so we will start, right? First, most important is your this one, cystocytes, right? Cystocytes, they are also known as helmet cells because they look like something like this, right? So cystocytes are helmet cells, right? So they are usually found in megaloblastic anemia, iron deficiency anemia, thalassemia, or microangiopathic hemolytic anemia, right? Thalassemia, right? So in these conditions we have the we have a table made above, as you saw. So we will get back to that later. Okay, now there is something known as basophilic stippling, right? We'll see the images, right? Basophilic stippling. Now basophilic stippling is found in lead poison. So we will find basophilic stippling. Every term is important here, right? So pay attention, right? Okay, so then there are Howell-Jolly bodies. Howell-Jolly bodies is found in defective spleen function, or we can say asplenia. Same thing, only defective spleen function, right? Okay, and then we have spherocytes. Spherocytes is found in hereditary spherocytosis, right? Okay, and then we have dacrocytes. And dacrocytes is seen in severe iron deficiency anemia or thalassemia, myelofibrosis, myelodysplastic syndrome, with most important being MDS. MDS is myelodysplastic syndrome, right? Then we have echinocytes. Echinocytes we is found in renal failure, in malnutrition, right? And this is in reversible conditions, right? Renal failure and malnutrition. And similar looking cells are there, acanthocytes, right? So where we can find acanthocytes? Acanthocytes are found in same renal disease or splenectomy important, but most important is a beta lipoproteinemia, very important, right? Okay, so acanthocytes in a beta lipoproteinemia. Okay, now elliptocytes. Now elliptocytes are found in iron deficiency anemia, with most important being MDS, myelodysplastic syndrome, megaloblastic anemia, thalassemia, right? Coming back to our somatocytes, right? These are found in uh, red cell membrane defect, means RBC membrane defect, okay? And also in alcoholism, right? And another important, target cells is look something like this. This is found in thalassemia, right? Most important. Then iron deficiency anemia and some hemoglobinopathies. Now we will get back to that slide, right, and we will see the subsequent images and the conditions, right. I hope the slide is clear. Let me zoom it more. Right. Okay, so yes, now see, this is our microcytic RBC, right. This is normal, right, and this is our normal cell, and microcytic means size smaller than the normal, right. This is our microcytic, right. This is our normal and this is our microcytic RBC, and microcytic RBC can be found in these conditions, right. Pyridoxine deficiency, thalassemia, iron deficiency anemia, sideroblastic anemia, right. So just remember these conditions, right. And what is this pyridoxine deficiency? This is B12 deficiency, right. B12, this has been asked, right. And okay, and both in pyridoxine and sideroblastic anemia we will give B12 uh, as a therapy, right. And now macrocytic RBC, where the RBC size is more than the normal. See, this is the normal and this is your macrocytic, and where you will find it in folate deficiency, liver disease, MDS is myelodysplastic syndrome, and chemotherapy. But the most important thing is vitamin B12 deficiency, right. Remember this. And also in vitamin B12 deficiency you can find excessive, these neutrophils, right. Now this one I was talking about, this one acanthocyte, this has spikes, right. See these spikes. So this is found in, just remember the conditions: A beta lipoproteinemia, most important, and post splenectomy, right. And other conditions are also mentioned, but these two being the most important, right. And now let me discuss about this one, echinocyte is found in, just remember the conditions: uremia, it is an artifact, right. See, it is more or less same, but this cell is something like this, right. Acanthocyte has spikes, but echinocyte is a blur type of spike, right. It is found mainly in uremia and liver disease. Remember these two, right. These are classic for uremia. Then cystocyte is also known as helmet cells. Okay, helmet cells. See, this looks like a helmet or beaten appearance. So this in microangiopathic hemolytic anemia and in mechanical valve, but also seen in other conditions, as I mentioned earlier. It is seen in thalassemia. It is seen in thalassemia. It is also seen in iron deficiency anemia, right. In megaloblastic anemia as well, but most important in the MAHA, and means microangiopathic hemolytic anemia, MAHA we say in short, or mechanical valve induced as well, right. And this is your bite cell. You see, it looks like somebody is bitten, right. So this is seen in GCSPG deficiency, and yes, remember this one only, GCSPG deficiency. Other conditions are given, but this is being the most important, GCSPG deficiency, right. Okay. Also I want to tell you that in case of GCSPG deficiency, there will be history of certain drug intake or certain intake of malarial drugs or hemoglobinuria condition, or the intake of fava beans, right. So this history will be there, so you can easily identify that this is GSP deficiency, with the characteristic cell being the bite cell, right. Okay, so talking about elliptocyte, uh, one second guys, let me recover the file. Okay. Okay, so this is elliptocyte. This is found in conditions like hereditary elliptocytosis and severe iron deficiency anemia. See this. Then we come to spherocyte. The cell is more or less spherical in shape. It is found in hereditary spherocytosis and autoimmune hemolytic anemia, right. Stomatocyte is found in hereditary stomatocytosis and liver disease, right. Target cell, very important, found in thalassemia and hemoglobinopathies, post-splenectomy or asplenia, but with most important is thalassemia, right. The target cell is something like this, right, as you can see in the picture, right. and this can be given in your case scenarios as well as a picture, right? Then I am coming to your sickle cell RBC. So the cell looks like a sickle shaped, right? So these are the different sickle cell traits: the hemoglobin SS disease or SC, SD, and mainly it is in case of sickle disease, right? And then TR drop. See, this cell looks like a TR. In myelofibrosis, it can be found, or in marrow infiltrates, right? Mainly you see it is found in MDS, myelodysplastic syndrome, or myelofibrosis, right? Hemoglobin C crystals, not that important. Red cell agglutinate C. This mainly in cold agglutination, where the RBCs get clumped together, right? See, next condition is our Role formation. Just when the RBCs are clumped together in a linear fashion, right? As you can see, this is known as Role formation. If you want to remember one condition with Role formation, this is multiple myeloma, right? Most important. Other you can remember chronic inflammatory or chronic liver disease, malignant lymphoma, but most important is multiple myeloma. Don't forget, has been asked multiple times. And also we will discuss this in further, in plasma cell disorders. We will discuss it in details, right? So we saw all this, right? Bite cells, Cystocytes, yes, we saw all this. So with I will like to mark the few important ones. Macrocytic is important, macrocytic is important, your bite cell is important, Cystocyte is important, and if I go there, here the most important is target cell, sickle cell, and teardrop, and also this one, Role. So this has been asked, previously as well. Now let me show you a few other images. One second. Now see, this one is your RAHUL'S bodies. See, this one, the blue pigment. This one is the RAHUL'S bodies, and this is mainly found in hyposplenism. Mainly, you remember one thing, splenism, and also in severe hemolytic anemia, but mostly in splenism, right? It's a DNA type of inclusion, right? Then there are Hinge bodies. So Hinge bodies can be seen only in supravital stain. Actually, this can be seen as, greenish colored bodies, and the entire in a yellow background, right? And the different type of supravital stains, right? So actually in methylene blue we see this greenish type of bodies in a yellow background. Okay, so there are Hinge bodies in this is a inclusion of hemoglobin type of inclusion, and found in mainly GSPG deficiency. Remember this one only, right? And Pappenheimer bodies, it's iron deposits in thalassemia, sideroblastic anemia, hemolytic anemia, and hemoglobin H, HbH inclusion in supravital stain goes something like this, and is found in HbH disease. Basophilic Stippling, as I mentioned, you cannot see that clearly. It is something, like this. Okay, so this is a ribosomal inclusion in found mainly in lead poisoning, also in MDS, sickle cell, thalassemia. Okay, so just remember these bodies, all of these are very important and has been asked, uh, in your aims, and the previous exams of aims, as they used to say that match the following or match the column, in which they used to give the bodies and the inclusions, you have to match with them, right? Or the conditions with the inclusions. Okay, so these are very important table, and just remember it, right, along with the this one, images, right? So I hope this session was helpful for you, and we will meet in the next session. And as you know, this all the topics I take has been asked previously in your exams only, right? In your previous pattern exams, in say in aims or all the national institute. So don't miss these points, right? Okay, so we will meet in the next session, right?